Good morning, everyone, and welcome to today's edition of Wellness Wednesday. Thank you so much for joining us for today's episode. And I just wanted to let you know that Wellness Wednesday is sponsored by Partners in Care Foundation. I am your host, Christy Lau, and I am a Senior Director within our Community Wellness Department at Partners in Care. For anybody who might be joining us for the very first time today, Wellness Wednesday is meant to be just a short burst of something fun, something educational, something entertaining during a time when we can't all come together in a physical setting. As you know, Wellness Wednesday meets every 2 weeks, and today is actually going to be our last episode of 2020 before the holidays. So we thank you so much for joining us. We will resume in January, and I will talk about that a little bit more at the end of today's edition. Just a couple of quick housekeeping tips. Everybody who has joined today has joined in listen-only mode, but that does not mean that you will not be able to ask questions or interact with our speakers today. In order to do so, I'd ask you to use either the chat function or the Q&A function here in Zoom, and I will be monitoring that to be able to curate questions for our speakers at the end of their presentation. Without further ado, I want to introduce our speakers, as today we're going to be talking about an exciting program called Stepping Up Your Nutrition. Here today we have Sue Lachenmayr, who is the State Program Coordinator. She oversees statewide implementation of evidence-based programs, assists in grant writing, partnership, capacity building, provides leader trainings for evidence-based wellness programs, and implements evidence-based community workshops. She is a co-developer of the nationally award-winning Stepping Up Your Nutrition, Malnutrition Session Zero. Sue was previously the Senior Director of the National Council on Aging Chronic Disease Self-Management Resource Center, where she led a team of professionals in providing national technical assistance to 47 state agencies. Here as well, we have Dr. Matthew Lee Smith, who is the co-director of the Texas A&M Center for Population Health, and as an associate professor in the Texas A&M School of Public Health. He has devoted his career to create partnerships and initiatives to encourage positive lifestyles. He has earned a national reputation as a false expert and evaluator of evidence-based programs for older adults. His involvement in local, state, and national initiatives have been essential to document the effectiveness of programs and innovations and assist in their dissemination across the United States. Dr. Smith is dedicated to improving the health and lives of older adults by increasing awareness about health risk and improving access to community and clinical resources. Without further ado, Matthew and Sue, welcome on in.
Outstanding and wonderful. Thank you so much for that introduction and for welcoming us to the Wellness Wednesday. We're so happy to be here. And so we are going to talk about stepping up your nutrition. And this is a session zero that was created by the Maryland Living Well Center of Excellence, and Sue and Leanne Eagle and their wonderful team there have created this brief intervention to understand and identify risk and nutrition risk for malnutrition, and then of course try to help individuals make healthier choices and get connected to resources. And I was just fortunate enough to be invited to help evaluate this initiative. So I was invited to the team to be able to better understand its dissemination and learn more about it. So what we were hoping to do today was to talk just a little bit about the tidbits from the intervention and give some tools and news you can use as you think about using this content in clinical settings, community settings, but can also be used just in your daily interactions with any older adult, giving those recommendations, giving that kind of encouragement. So on the next slide, just some high level importance. We know that about 1 in every 5, upwards to 1 in every 3 older adults in the community have some form of risk of malnutrition. Now, we do understand that malnutrition is improper or poor nutrition, and it can be the minimum or imbalanced amount of nutrition and nutrients that we need for health. So when we talk about malnutrition and poor nutrition, we're really just thinking about what an individual consumes and what they need to be healthy and protect themselves from any other types of adverse effects. And so we also know that individuals who are in clinical settings in the hospital, a larger proportion are actually malnourished, upwards of 60%. And this is especially concerning, but it also kind of speaks to that recursive nature of where a health condition or the reason they're in a healthcare setting or hospital can cause malnutrition, but also the malnutrition can cause the health conditions, and it becomes a bit cyclical. But we do know that those individuals who are malnourished certainly have higher rates of mortality, and also that the hospital stays and the complexities of their situation are prolonged over time. So they can stay in the healthcare system even longer, which can create additional problems. So malnourishment, poor nutrition are certainly very important topics, but let's go ahead to the next slide and talk about some myths and misconceptions and just talk about some facts as well. I think oftentimes when individuals speak about malnourishment or improper nutrition, there are some misconceptions. And one of those is that you can very visibly see malnutrition, that you can see the frailty, you can see the wasting or withering effects. But the reality is that malnutrition and malnourishment can take all shapes and sizes. It comes in all shapes and sizes. So an individual who is maybe more slight in build, or some of those who are maybe a little more overweight or obese, could be signs and symptoms of malnourishment. And so it's not only a certain type of individual, it's much more about the composition of the nutrients you take that makes you nourished. And so therefore, we really need to focus on and think about the types of foods, the types of nutrition that a person has, and that can help them to become nourished, and not just say that if we can't visibly see the malnourishment, that it's not occurring. And that really leads to the next one. So Christy, on the next slide, malnutrition can hide in plain sight. Like I said, malnutrition comes in all shapes and sizes, but at the same time, what we really need to consider is that unless we do assessments, unless we actually ask the questions, we might not be able to see the malnourishment that's right in front of us during our interactions with older adults. I know that from the delivery of Stepping Up Your Nutrition, it was linked as a session 0 with Stepping On, a fall prevention program. And when those participants were asked about their nutrition and their risk for malnutrition, about 70% indicated they had some form of nutrition risk, whether that be moderate or high. 70% of these fall prevention program participants had malnutrition risk. And with that said, that's really important, because if we would have never done the Stepping Up Your Nutrition session 0 intervention with them, we would have never known. They would have gone unnoticed, unrecognized, and therefore, again, hiding in plain sight. The third fact that I'd like to share, of course, is, like I mentioned earlier, it's a bit of that recursive nature. Malnutrition can cause health consequences, and those health consequences can cause malnourishment. And so when we think about the causes and effects, we know that there are many. Having chronic conditions is certainly one of those risk factors, but also the medications that an individual takes could cause appetite suppression and other types of side effects that influence the amount of nutrition in the foods that people consume. We know that some of these root causes of malnutrition can be based on the social determinants of health, lower socioeconomic status, food insecurity, and other types of limitations for transportation, etc. But we also know that some of these can be associated as people age in terms of oral health. So as people have dental problems, as we age, our taste buds change, and maybe food becomes less desirable or less delicious to us. But it can also change our appetite and change what we eat, what we prefer to eat. We do know that social isolation and living alone is certainly influential in malnutrition and the types of food that come into our household. So those who rely on others, caregivers, or just community or social services might be at a higher risk in many ways. And then, of course, as we know, folks who would have any kind of lack of mobility, frailty, sarcopenia, any kind of dietary restrictions, we just know that there are a lot of conditions. And like I said, those conditions can cause malnourishment, but also the malnourishment can exacerbate these types of issues.
Matthew, I just want to add here that during this time under COVID, we're doing a lot of work with people who have depression, who are truly additionally socially isolated, and we really are seeing much more risk of malnutrition again in older adults who are in the community.
Absolutely. And on the next slide, I think this is one of the biggest misconceptions that we face, and unfortunately it persists so often, and that is just eat more. And just eating more is not the right answer. You can't just feed malnutrition. That's part of it, but it's the foods that you choose, the foods that you're provided and have access to that contribute to your nutrition. So it's extremely important to think about a balanced diet, to think about the different types of food groups and the proportions of the food that you get so that your body can function the way it's intended to. And so we really want to make sure that we understand the types of foods are so much more important than the amounts of food. The amount's important, but at the same time, we really need to concentrate on those good foods. And so when we think about stepping up your nutrition, as Sue will tell you in a minute, we really do focus more on the protein and the hydration. It's not maybe the all-encompassing everything you need to know about your diet, but we do raise the issues of what is poor nutrition, what is malnourishment, and what is it not? How do we address it? How do we recognize it? And so, yes. And so on the next slide are a few facts that we naturally understand when we're trying to identify. One of the best ways that we can identify malnourishment or poor nutrition is to ask questions and to be able to do an actual assessment. Now, maybe that's not a diagnosis, but at least an assessment that can help us to understand. So asking good questions, there are many different screening tools. I point you towards the National Council on Aging. They have a lot of nutrition risk screeners out there where you can go ahead and learn more about how to integrate those into your clinical or community site. But when we think about malnutrition, there are some overwhelming risk and warning signs. One being unplanned weight loss. Another would be the loss of an appetite. The other would be not able to eat or only able to eat small amounts. Again, that could be because of medications, oral health, all kinds of other issues. Feeling weak or tired, which is certainly, as we all know, if we've been hungry, we understand those kinds of feelings, and this is much intensified. And then, of course, swelling or fluid accumulation, which is a very big indicator of some form of malnourishment. And just to echo on that and build upon it on the next slide, just when thinking about fluid retention, this is one of those side effects and one of those indicators of malnutrition that's very visible. However, malnutrition is a primary contributor to edema or any kind of fluid retention, but at the same time, it's not the only. A lot of chronic conditions can cause this kind of swelling, especially in the lower limbs, and it could be from kidney functioning and other chronic conditions. It could be because of the different medications and the inability of the body to be able to hold on to some of the salt and the other nutrients. So we talk about protein deficiencies and other issues. The reason we raise this is because when we look at stepping up your nutrition as focusing on protein, lower limb strength for fall prevention, and muscle, but as well as hydration and fluid intake, we just like to recognize that people who are experiencing swelling and edema need to very much monitor their liquids and hydration. We encourage more hydration because dehydration is a huge risk, but at the same time, we also make sure that the individuals know to consult their clinicians, their physicians, to really get medical sound advice. And with that, I'm going to turn it over to Sue.
Thanks, Matthew. Thanks very much. So next slide. This, of course, is one of our favorite slides. Matthew and I have different opinions about food and what to eat when, but this is a great introduction to show and really emphasize. As Matthew said, the program, we worked with registered dietitians and others to develop this session 0. And we know it's much more complicated than just proteins and fluids, but these are really key measures that are so important, and older adults often lose the interest or ability to recognize that they are thirsty or haven't had enough to drink. And protein, just because oftentimes we think of meats and other things, may be something that the older adult's not getting. Again, those oral problems can be an issue as well. So we really tried to make this as simple as we could. And that was the messaging is understanding how nutrition and falls are connected. I know there was already a question in the chat that asked, absolutely, this can make huge difference in fall risk. And then understanding about muscle strength and how our whole body has to work together. And then the message is very simple: proteins and fluids throughout the day. And then we end it with action planning. A lot of you might already be familiar with this kind of strategy, but that's part of what we use in stepping up your nutrition. Next slide. So again, the reason that nutrition plays a role in falls prevention is that if we're not eating enough, or if we've been ill and don't have enough intake, it really weakens our muscles and increases our fatigue. And again, if we don't drink enough fluid, we can get dizzy, we can feel weak. And another reason that there may be additional falls. So understanding how much they are tied together. So the relationship really is a good one. It can also be positive. And so eating, as Matthew said, a balanced meal gives us more energy and physical activity, which is really important. Next slide. So the importance here is that we all know that we have muscles, and some of them we think we can see, but they're throughout our whole body, right? And so we really have to think about it. Includes our heart and other things. Next slide. So at what age do you think we have the most muscle? I think we're going to put this in the chat so that people can respond to this. So your choices are between the ages of 15 and 24, 25 to 40, 41 to 55. So I already know I'm well beyond this. I'm not going to make it with having the most muscle, but let's see what's happening in the chat. Anybody?
I see a lot of
ideas?
B's.
A lot of B's.
A lot of B's, a few A's.
Okay.
But
well,
overwhelmingly B's.
Okay, Matthew. Well, so let's just take a look here. Next slide. So again, you know, the importance is, if just look at the one picture on the left-hand side, and you know, the leg looks the same, but understanding what is muscle and what is not, in the difference in the age of two folks. And so for those of you who said that age 25 to 40 is where actually we have the most muscle strength. Exactly right. Okay, so good job. Next slide. So again, you know, we really do focus on protein and its importance in linking to muscle, in providing us a sense of being full, fighting infection, helping us to heal our injuries. And we don't think about needing more protein as we age. So that is what's so critically important. And we focus a great deal on all kinds of alternative protein-rich foods. You can see fish here and chicken, but you see beans and peas and nuts. Again, other sources that are so important. In fact, when we do this as a session 0, we do a tasting during the session and bring a lot of things that older adults might not have tried. Next slide. So here are, again, we have a lot of great handouts that we use, and this just shows, yes, we certainly do get a lot of our proteins from animals, but there are many, many, many choices that come from other foods as well. Next slide. So again, I mentioned earlier the importance of drinking fluids. You know, we lose as older adults our sense of taste, our sense of smell, and that sense that we need more fluids. And they're just so critical to help us digest our food, absorb the nutrients, get rid of the waste in our bodies, preventing consumption, lubricating our joints. You can just see the list of things that make fluid intake so tremendously important, and really so that we do prevent dehydration. Again, makes you feel weak and dizzy, and there's that fall risk again. So as we get older, we really have to think and be very intentional about drinking more fluids throughout the day. And so the recommendation is, if you do have a balanced diet, 4 to 5 cups, and if your diet is low in fruits and vegetables, then 6 to 8 cups. So we go through that in the session and really help folks to really better understand what they need to do. Yes, Matthew.
You know, one of the things that we do in the session 0 is to help brainstorm a bit about the strategies to increase hydration. So many people usually will only drink their liquids with their meals, but that might not be enough, or maybe that's just that they're not even eating 3 meals a day. So we kind of brainstorm those strategies of, you know, from setting an alarm to carrying a water bottle. But I would like to take a minute, if anyone out there has any strategies, how would you increase or recommend older adults to increase the amount of fluids they drink? What are some strategies? What are some creativity? And maybe just give a minute or two to see.
Sure. I think it's a great idea. And while you're putting your answers in the chat, you know, one of the things that I hear about a lot is older adults who drink much less at night because they're aware that if they're drinking in the evening, it means that they're getting up during the night and have to urinate, which, you know, there is a false risk there. So many folks are really concerned about when they should take that liquid. All right, so we're getting some here, right? So plan a certain amount at every hour, which is great. Again, you know, it doesn't have to be a lot, but as long as you continue to drink fluids, that's great. Others?
One of my strategies, of course, is to go ahead and try to place a bottle of water in right next to my counter where I'm going to have my breakfast. So the first thing I do in the morning after I get up and get ready is I will put down that water, and it's just that reminder, that visual to start the day off.
Sure.
But I'm seeing others like adding flavor, lemon, lime, herbal teas, etc. So thank you for putting your suggestions.
Yeah, absolutely. And really all of those work, and certainly coffee and teas are part of that. Alcohol, not so much, but any other fluids, yes. And we often forget that fruits have a lot of fluid in them. And certainly, you know, you think about if you're having cereals, you've got milk. So again, there are lots of ways to get that additional fluid. Go to the next slide. So we end the sessions always with encouraging people to make some choices and changes. Many of you, as I said, hopefully are familiar with action plans, and that's what we do. We encourage folks to get one or two goals, make it really simple, encourage them to stay positive and to try out those new eating habits. And we really look to encourage people to have a support system. When we do programs in the community, we make sure that we have resources on the food banks and other strategies and opportunities for older adults and others to be able to access food. And the next slide, I think, is a sample of an action plan. So normally it's something that we want to do, not something that we have to do or should do, but we've given some suggestions here. And that's the kind of thing that we try to encourage and to make sure that people understand what their risks are, especially eating alone, we know is huge. So many of our seniors are at this point in time, they're not out, they're not doing any of that. So, and if you're by yourself, it doesn't seem like it's worth the trouble to even fix a meal. So those kinds of issues really, I think now are increasing overall risk of malnutrition in community. Matthew, more from you?
No, I completely agree. And the other thing that it's doing, because not everybody is going out and being as social and unable to maybe get to certain places, it's actually creating a situation where there's more and more sedentary behavior. And that sedentary behavior can also contribute to, improper digestion and some of the other things where you're not optimizing your digestion, your utilization of what you're eating. And so therefore it can cause all kinds of other problems. And also there's even higher reports during the pandemic that people are just eating poorly. It's harder to get the fresh fruits and vegetables, the fresh meats. And that's not to say that you can't eat the frozen in the can, because you should, but instead they're snacking and eating more of the junk food. The other thing I would also say that's really important, and I've seen in the chat too, is that there's always concern with any kind of diuretic, whether it be a coffee or a tea. So while those the stepping up your nutrition really focuses on the hydration and making sure that more liquids and fluids are consumed, we try to focus on not having those diuretics, because somebody, certain individuals with certain conditions shouldn't be having coffee or tea. But at the same time, consuming fluids overwhelmingly is beneficial in many ways. So,
and I just saw a great suggestion in the chat that was somebody that Zoomed meals with others in the family or friends, which is great. And I see Diane Davis is on, and she is saying herbal teas are fine, and yes, they absolutely are. And we really encourage people to check with their doctor about the amount of fluid that they should be taking. But we do say, because I think coffee and tea are really a habit with so many of us, that's okay. That's okay. And so does as well. The point here is making sure you get the fluid. Ideally, it's more and more water, but we'll take it the way we can get it. How's that?
And I also just saw soups, and I totally agree. As the winter months are upon us, especially in other parts of the country, maybe not California, but where Sue is in Maryland, soups and stews are great ways to get liquid.
Yeah, absolutely. And next slide. I think we are at the end and welcoming your questions and your input. I love to see so much activity in the chat. That's really great. And we'd like to hear from you. What else? What else are people thinking?
Absolutely. So please go ahead and enter your questions for Sue and Matthew in the chat box, or you can also use the Q&A. And I do see a couple of questions coming through Q&A right now. So the first one is, are there other signs of malnutrition visible to an observer, like a doctor or nurse or a caretaker? And why is nutrition not monitored in a hospital setting? Or how can medical staff confirm malnutrition? Maybe test for it?
So the most recognized nutritional screenings can be done in the doctor's office. There usually are those questions about losing weight, unintended loss of weight. I think in terms of hospitals, I certainly know our local one on the Lower Shore, really does monitor food intake of patients in the hospital. And they do some of those queries as the patient is being discharged. So those are important pieces that need to be done. Matthew probably has some more information.
Yes, and again, sometimes there are those signs and symptoms, whether it be some swelling or fluid retention or wasting or frailty. But otherwise, during their stay in the hospital, the foods and the meals that they're providing can be very well balanced and provide that individual with what they need at the time. But the situation they've come into has already created a situation that's more of a trait situation. And like Sue was saying, upon discharge, that individual will likely go right back to whatever patterns. So asking the right questions and actually monitoring how the individual comes in is very important to understand how they're going to go out of that clinical setting.
Yeah, and we do work with our local hospital in providing shelf-stable meal packages. And those are often frequently given to clients who are being discharged from the hospital, and then follow up with a care coordinator or others once they're home.
Great. Another question here. How much protein should we eat per day or per meal? What about vegetables and vitamin D? Do they help with muscles?
So great question. And as I said before, we're very simplistic in the messaging that we're doing in Stepping Up Your Nutrition, but you're exactly right. We need our vitamins, we need the fruit, the vegetables, all of these other components as well. And really the protein intake varies, with your age and your body size, but we're really talking about and really try to encourage protein at every meal. And then depending, adding some of those snacks. We encourage people if they tend not to get that much protein, to identify and use some of those protein-rich drinks or the protein bars, any of that. Again, as older adults, they in general are not eating enough protein. Very rare that they eat more protein than is recommended.
Great, thank you. We have a question
and I think the second part to that, I'm so sorry, I didn't mean to step over, but the second part to that question was about the vegetables. So I know that the animal products and the beans and legumes and some of these other things are really what we focus on because there's so many other ways. But yes, broccoli, Brussels sprout, they do have protein, not as much when you compare, but anything helps. And so that's one of the fun things Sue and I talk about. I love Brussels sprouts, and I'm always all about the Brussels sprouts. And she says, but that's not really our messaging. I said, but it's part of it. So it does have protein.
So he's got a plant here asking those questions.
I think that probably helps with another question that we had in the chat box. We have somebody who appears to be perhaps a caregiver for her mother. Her mother drinks only, coffee and juice, water, maybe not so appealing. It causes dehydration, and she herself can identify with that. She may have her own strategies, but she's having a hard time thinking about strategies for getting her 84-year-old mother to increase her water intake.
So there are other foods you can think of. Think about Jell-O, for example. Think about ice cream. Again, we talked earlier about soups. There are ways to increase that fluid, and that's the piece that you're really looking to do. And certainly there were a number of recommendations in the chat about the flavored waters, making it look like a special drink that has, a mint sprig and, pretty colored ice cubes or something like that in it. I mean, ways, again, I see grapes and watermelon, absolutely. Those are things to think about in terms of getting more fluid in. So while we talk about water, and that's what we think about, it is so many of the foods that we eat. And I saw somebody, Matthew said roasted Brussels sprouts. So, we're all ready.
Well, and the other thing is just what Sue was saying with the Jellos, the stews, but also with the other fruit and vegetable consumption. That's a great way to get more hydration, but also just whatever kind of beverage they do enjoy, add ice.
Yeah.
Unless it's a hot beverage, adding ice just, again, helps to add more hydration to any kind of drink.
Yeah.
And what would you say to those people who maybe are not so keen on the, perhaps 3 meals a day, the breakfast, the lunch, and the dinner? Maybe we have some folks who are grazers, right? They'll just kind of pick at things throughout the day because maybe their appetite fluctuates. Maybe it was because of, a surgery or, recovery from even illness. In lieu of, forcing yourself to eat and, not having that be a pleasurable experience, what would you say to those folks to be able to, get that necessary, amount of nutrients in their body?
So there's a case, I think, where some of those drinks, those high protein drinks, are really helpful, can really be helpful. They can be chilled, and as I say, when we do a tasting, we bring those, we bring hummus, we bring products that people might not normally try. But I think you have to be able to allow people. I have a number of clients who don't eat 3 meals. They will snack off and on throughout the day. And that's perfectly fine. But most of the time when we're snacking, we're not thinking protein. So that's where I think at least that encouragement of those protein drinks or protein bars or the nuts, those kinds of things that would be still adding that protein, that necessary protein.
Absolutely.
I think that one of the issues with grazing, and it's really a great strategy instead of having to sit down at every meal, and it works well for others, but it becomes less planned and it's more difficult to monitor a lot of times.
Yeah.
And so that's one of the things where grazing is great, but it also depends on what you feel like eating. You're just going to graze, or you're going to gravitate towards certain things. So if you're still in a grazing kind of schedule, to be able to really intentionally try to identify the times when you're going to introduce the proteins, and at least when you're grazing, have a mix so that you're integrating the proteins throughout.
Oh, smoothies, I see. Of course.
Yeah. Drinking our fruits, right, sometimes makes it more fun. And I like so much too that you talked about, the impact that nutrition has on our risk of falls. I do see somebody here in the chat that's talked about, an incidence of falls that's been pretty frequent. And, same person who asked about, the grazing and, thinking about those eating habits or, hydration habits. And I think that we've made a really important connection today about the importance of, nutrition or the impact of malnutrition on falls. So hopefully, this helps to provide some tips, thinking about, what makes eating or drinking fun, but also nutritional and hopefully makes you feel good.
That's right, Chrissy. One of the things when we first start the session 0 is to ask people what food means to them, which is a wonderful way, because so many of us, the first thing, yes, I enjoy cooking, but I think about the social interaction. To me, that sharing a meal with family and friends is so important. So, and think about these times, which, we're not all together. So other ways that we can think about getting the nutrition that we need in times, when we are not able to socialize. And I loved that suggestion of Zooming a meal with family and friends is a great one.
Mm-hmm. Can you guys talk a little bit about stress eating and kind of what that looks like for many of us, and how that may help or hurt, or thinking about nutrition and malnutrition and the balance thereof? When is eating, but when does it start to kind of teeter over to harming us more so?
Yeah. Well, Matthew mentioned, that people during COVID are not eating as well. And we already know early results are that many people are gaining about 10 pounds during this time, which is certainly stress eating, I think. Yeah, go ahead. Oh, you're not one of those, Matthew. You work too hard for that, I think. But I do think, there are really going to be some health consequences to pay for things. And, in terms of stress, we have so many other wonderful resources and programs that really work around those pieces. Our chronic disease self-management programs and diabetes programs. I've just been recently doing programs with caregivers of family members with dementia, and the stress in those families and the stress level of those caregivers is really high, even higher these days, because that individual can't be going to daycare, right? So they're really, we were just talking earlier yesterday about 36-hour day of caregiving, so there's definitely stress, and so I still will stick with adequate protein and fluids will make a difference there as well. And again, just being more aware, I think, is really an important piece of that.
One of the things that I would add to that is that stress eating is actually a function of what you have available. And so with strategic planning and making sure that you have enough things in the house, that as you're going ahead and having those stress moments and you're wanting to eat, that you have some of, the nuts, the raisins, the things that are a little healthier, so that it's not always the chips and everything else, the ice cream and everything else. And the other thing being, and I know it's not that great for the environment, but one thing that can help people monitor stress eating is having individually packaged portions, like little boxes of raisins and other stuff, so that it's not always just one more handful out of a big bag. And so that can help you to temper a little bit of those cravings and at least monitor.
Yeah, absolutely. This is certainly a time when, even those, who live alone, or even if, you don't live alone, going about your daily routine, or perhaps, whatever you did pre-COVID is just not possible. And like you both said, it can be a really isolating time and heighten our stress levels, right? So I think, we've gotten a lot of questions about, the ability to manage the stress, but also manage your nutrition. And I think it was so important that you brought up the action plan, because, right, we don't need to be jumping from ground zero to ground 100, but, bite off little bits and pieces of what's doable for us, and start with smaller steps.
Sure. And I think my contact information is on the last slide, and happy to hear from you. We do anticipate that we're going to be doing some virtual Stepping Up Your Nutrition leader trainings in 2021, so stay tuned.
Somebody asks, what are good substitutes for chips and popcorn and cookies? Holiday times, guys, those cookies come out.
There you go. I know. So I do think Matthew's idea of those smaller portions is great, but certainly, there are so many good nutrition bars out there that one can have, fresh fruits. There's a lot of things. We just have to reprogram our minds, that the potato chips, it always, I have to say, it always amazes me. I try to buy, whole grain breads and things like that. And I, you look at the pictures of a loaf of bread, loaf of Wonder Bread that can live for a really long time. It doesn't get molded. It doesn't, it's just there. And if you think about, what goes into a lot of our, prepared foods, you really understand that, fresh and natural are important, really important. And I think, again, it's just, we have to take some responsibility ourselves. When you're talking about stress, I think one of the other things is meditation and, visualization. So that's why I think so many of the evidence-based programs are so important, because they really do focus on some of those other strategies to help us. And I know Diane had said substituting fresh fruits and smoothies. I know it started though with something about your mom being a nutritionist, Diane. You have to put more in there. I didn't catch the first part.
That her mom was a dietitian and she used to give her cheese lollipops, and not candy lollipops, but cheese lollipops, which as an adult, that sounds pretty awesome.
There you go.
And it's not for everyone, but there can be those simple substitutions of what you make your cookies out of, or substitute or try to make kale chips or some other veggie chips. But also I've seen some really creative things where you can take grapes and berries and blend them up and basically freeze them for like in some honey for some sorbet or something like that. So the same kinds of, we don't have to deprive ourselves. And I think the key is we all know where we want to be and what is recommended in so many ways with our nutrition, but we have to start where we are. And we have to understand that, we still have to exist. So we can do better, but we also don't, Christy, to your point, go from ground zero to ground 100 immediately.
Yeah,
absolutely. You both mentioned the National Council on Aging as having really great resources for us here in the United States. I did see a question about perhaps resources outside. Maybe do you know of any international resources or ways in which perhaps somebody could look to the National Council on Aging and apply those resources to their locale?
Well, so the resources on the National Council on Aging website are open to anyone, and they have lots of information on nutrition and screeners and other components. So definitely, one can go there, one can go there are any number of organizations around the United States, I would hope around Canada too, that are focused on nutrition and on access to healthy foods.
Absolutely. I did see a request for Matthew, your contact information.
Yes, I'll go ahead and type that in. But I also wanted to make sure, I've seen some other comments coming in. Stepping Up Your Nutrition can be a standalone brief intervention, but it can also be tied as a session zero to any evidence-based program, whether it's stepping on chronic disease self-management education, workshops, a matter of balance, any of those that you have access to. It's just another great way to serve as a session zero, but also that content can be used by clinical or community organization staff, community health workers, so many different types of caregivers, to just be able to use that and try to get some tips to your older adult loved ones, clients, patients, whoever it is. So I definitely want to do that. And then I'll type my contact information.
Perfect. Well, I think that that's a perfect segue. Thank you to both of you for this wonderful presentation. I think it's a time when nutrition is such an important thing to consider for all of us. Both Sue and Matthew mentioned other evidence-based health promotion programs like Stepping On, A Matter of Balance, Chronic Disease Self-Management, Arthritis Exercise even. All of those things are perfect complements to the information that was presented here today. If you want more information or you want to enroll in one of those programs, you can go ahead and find that information on our website at www.picf.org/online-wellness-programs. Here you see as well the contact information for Sue should you have any additional questions after today's session, and Matthew has shared his email in the chat box as well. As I mentioned at the beginning of our session today, Wellness Wednesday is going to be taking a little bit of a break for the holidays. So this is the last time we'll see each other in 2020. But on January 13th at 10:30 a.m., we are going to resume our Wellness Wednesday series with a presentation about home meds. So if you or somebody you love has ever wondered, what does this medication do for me? Or I'm a little bit worried, I'm taking a lot of medications. Do they have any interactions with each other? Maybe something I'm eating. This is going to be the session for you. Home Meds is going to be a program that might be helpful for your scenario or for a loved one scenario. I did see one of the very first questions that we had come up ask, when did Wellness Wednesday start? So all of our Wellness Wednesday segments are at 10:30 a.m. Pacific time. So I know that some of you may be joining us from outside of the Pacific time zone, and we absolutely welcome that. We actually started this series in September, right around Fall Prevention Awareness Week. And we thought, you know, we've got to find a way to engage with people because this is just going on a little bit longer than we thought it was going to. So we hope that you have enjoyed today's session, and we are so excited to welcome you back in January. We hope you have a wonderful holiday season. We hope that everybody stays well and stays safe. We will see you.
Happy holidays, everybody.
Happy holidays.
And thank you.